What's the best treatment for an ankle ligament tear or a talofibular ligament tear? I would say, bar none, is prolotherapy. The most common ligament that's injured in the body is the anterior talofibular ligament. That's on the side of the ankle, Prolotherapy, so that it's obviously a common thing that we see, and really the best treatment for ligament injuries is prolotherapy. Exercise weakens the ligament. Physical therapy, you can strengthen the muscles around the joint, but physical therapy or exercise itself can't cause ligaments to regrow. Once a ligament's stretched out, the anterior talofibular ligament's stretched out, and it gets stretched out when the person turns their ankle in, and probably at least half of ligament injuries, like when you sprain your ankle, about half of them don't actually get back to their original strength, by healing by itself. So it means that, there's a lot of people who have a lot of ligament injuries around their body. You fall on your arm, you sprain your ankle. I mean, sometimes the pain will go away, but the actual strength of that ligament actually is compromised. So anyone who has pain or they feel like their ankles keep turning in, like they're runners and they keep turning in, I mean, you really should get prolotherapy because every time it turns in, I mean, you're running the risk of like having a really serious ankle injury. So the best treatment, I think, for anterior talofibular ligament injuries, ankle sprains, ankle instability is prolotherapy. Typically, you just need a few treatments because it's a very superficial ligament. It's easy to get to, and it responds really, really good. You can work out, you can run while you're getting treated. So it's just a few treatments. That was actually one of the first areas that I ever had done in my body because I had really weak ankles. I couldn't even ice skate. Like I actually literally I didn't have the ankle strength to just ice skate. So that was one of the first areas when I joined Dr. Hummel, like in the early 90s. I got my anterior talofibular ligaments treated by him, and really my ankles have been fine for probably the last 15 years. I ice skate, I run, I've done numerous marathons, ultra marathons, and ankles are great. So would really recommend prolotherapy for that condition.